All right, good afternoon, and thank you guys for following us on to this next session on, let's see here, where is my list?
Well,
It's not our physical therapy, but it's career opportunities and education driven. And our speaker is Laurie Daigle, and she is her prior role as the physical therapy assistant program director at Germanna Community College. But I will let her share her next venture as she is in the midst of moving. So we're honored to have you here today. So you can take it away.
thank you very much. I'm delighted to be here. So, as Stacy said, I am Laurie Daigle. I'm a physical therapist. And for the last 9 years, I've developed and then was the program director for the physical therapist assistant program at Germanna Community College. Before we came to Virginia, we were living in the Cleveland, Ohio area, which we always loved. And an opportunity came my way to teach back in Ohio. And so I am in the middle of 2 positions and moving and all of that. But I am delighted to represent the Virginia Community College system and Germanna Community College to help you all understand a little bit about what physical therapy, education, and your career paths might entail. So if anybody wants to put in the chat whether they've been thinking about physical therapy or they've been in physical therapy and maybe why you're here, I'd love to know kind of a little bit about you all and what brings you to this session. Of course, I have to find my chat now because it all disappeared. Well, I may not be able to see the chat, so.
I can manage the chat for you.
What
Not seeing any comments yet, though. Y'all don't be shy now.
Don't be shy at all. We are here just to answer your questions and hopefully give you a little bit of ideas for the future. Oh, there it comes. Let me open my chat real quick if I can. Okay. Somewhere else. All right.
Maybe ask your question one more time, just in case they were getting acclimated.
I am getting, like me, trying to remember how to find things on Zoom. My new position, we use Teams meetings, and so I'm having to get used to that, and I've forgotten where things are on Zoom. Oh, how quickly we forget things. All right. So let's talk a little bit about what the role of physical therapists and physical therapist assistants are in healthcare. So I took this definition from the American Physical Therapy Association. So this is our professional organization that helps us with all kinds of things in terms of policies and what our clinicians can and can't do, and also helping in the legislative area to help make sure that we are able to provide the care and be reimbursed for it out in the community. So physical therapy professionals, and that includes PTs and PTAs, are movement experts. So if you like movement, if you are an athlete or a dancer, which is also an athlete in my opinion, that's my personal background that got me to physical therapy, or just working out for pleasure. If you like movement, this is a great career for you. We're movement experts who improve the quality of life for a patient through exercise, hands-on care, so manual therapies, and patient education. So that's a pretty broad definition. but it covers an awful lot, and it covers an awful lot of patient diagnoses and all across the lifespan, from pediatrics to geriatrics and everything in between. I have there the link for apta.org. So that is an easy link for you to write down. And they have a link on their website that I've copy and pasted here, where you can go to your career and you can find videos of people talking about what it is they love about being a physical therapist or a physical therapist assistant. So I encourage you to check that out. So we have sort of a tiered system in physical therapy, just like we have in physicians. So physicians sometimes have physician's assistant. Sometimes you call to go to the doctor and they set you up your appointment with a physician's assistant. And that's a really kind of equivalent system. So those two fields, the physical therapist and the physical therapist assistant, are both licensed professionals, educated and licensed professionals. Beneath that, or in addition to that, as a care extender, we have what are called physical therapy aides or technicians. It just depends on the setting, whether they call them techs or aides. And those are not licensed. So that's a job you could go out and look for, even if you're just thinking about this as a career. And then there are sometimes people who are just in the office in the PT clinic, working on billing and scheduling and all that. So that's another way a person, before they go into this field educationally, could get some experience in physical therapy. I know before I started, I went back to PT school quite late, actually, after a couple of different careers, dance being one of them. And I worked as an aide in a hospital, doing a lot of transporting of people from their room to the physical therapy clinic in the hospital. And that was a great introduction to the field. Plus it helped while I was in school because I had access to people to pick their brains and ask them questions about my curriculum. All right, so you have two fields up there that require education and licensure, and then two that do not have specific requirements for that. All right, so let's talk about what it takes to be a physical therapist. Over the years, physical therapy has required a greater and greater and greater educational threshold. When I got my degree, it was actually as part of a bachelor's degree. It quickly went through a master's degree period, and that didn't last very long. And now it is what we call a doctor of physical therapy degree. So what it requires is a bachelor's degree and then to apply to a PT program as a graduate student. Okay, that's the only way to become a physical therapist now, is to get that doctorate. So that's a lot of education. 4 years of bachelor's degree plus 3 years of PT education, that's 7 years. So was there a question? Okay. So I've kind of looked at some average costs and estimated what the, thanks for the question, Kanisha. I will get back to that. So I've estimated the costs for a PT degree. And so an average bachelor's degree might cost $15,000 a year. It would cost less if you go through the Virginia Community College system and get your first 2 years with a reduced cost. But that's an average public university cost per year. And then a PT program, it really does range, but because it's a graduate degree, that costs more. So anywhere I was finding in Virginia, anywhere between $19,000 a year and $37,000 a year. So that's a big chunk of change. And we'll talk about some other options for that possibly. So those are estimated costs. So yeah, what are the goals of a physical therapist? Our goals for our patients are to make them as independent as possible. So whether that means if someone can't walk independently, we want them to be able to get around. So if that means training them how to use a cane or a wheelchair, fitting them in an appropriate wheelchair, anything to make their mobility as independent and safe as possible. So that's one goal. We want to make our patients as pain-free as possible. One of the things we're actually that I'm really proud of our association, the APTA, for is they started an endeavor where it's a hashtag choose PT. And choose PT means try that before narcotics. Choose an intervention that has less of a risk of getting you, giving you another problem, such as a dependency on narcotics. So we want people to be pain-free with as little narcotics, as little pain medication as possible. Let's see, that's 2. I think 3, I would say we want our patients to have ownership of their health. So we give patients the tools where they can go forward and be confident that they can do a particular exercise routine or walk every day safely, because we've set them up with safe parameters. If you ever had it's almost like being a life coach to be a PT. And then for a 4th one, I would say we want our patients to be educated, to sort of know where to go for good information, and be as educated as possible about their health. So those are just off the top of my head. I hope that helped. Did that help? Great. Thank you for the question. I hate just reading slides. All these years of Zoom. All right, so now let's talk about what it would take to be a physical therapist assistant. So a physical therapist assistant can do almost everything that a physical therapist can do, with the exception of doing the initial evaluation and assessment and the official discharge of a patient, and then a couple of things like dry needling. Anything that is invasive to the body are reserved for physical therapists. But a PTA has a lot of autonomy. That means they can decide what's best for the patient within the parameters of the plan of care that the PT sets out. A PTA requires only an associate's degree. And I say only, but I'll tell you, we have to cram in. We have accrediting bodies that tell us all the things that PTAs need to learn. And it's almost everything that PTs need to learn, but in 2 years instead of 3. So it's not an easy program. But it is an associate's degree. It's usually somewhere between 60 and a maximum of 68 credits, and usually can be done in 5 semesters. Successful graduates earn the Associates of Applied Science in Physical Therapy Assisting. And so In the VCCS, we're looking at maybe $12,000 total for the 2.5 years to become a PTA. Private colleges, places, there are other places that I'll show you in a little bit, like South University or ECPI. Those are private colleges, and their fees can be up to $50,000 total. They do include things with that, such as textbooks, but they're, the Virginia Community College system is very inexpensive. And I will add that I hope someone else has talked about the G3 funding in Virginia. Physical therapy assisting is a qualifying degree under the G3 financial assistance system.
Yes, earlier today they had the financial workshop and they discussed scholarships as well.
Great. So that means that if you get some other grants, G3 will pay for the rest of it. I mean, so it can be virtually cost-free for qualifying students. All right. Any questions about the kind of comparison with the education piece? Okay. So here are the 9 CAPTE accredited DPT programs, so physical therapist programs in Virginia, and this was as of June 2022. So CAPTE is our accrediting body, and in order to become licensed, you have to graduate from an accredited program for either the PT degree or the physical therapist assistant degree. So these are the 9 programs that you could attend in Virginia. There are, of course, many, many more nationwide. But they're pretty well spread out from Stanton in the south. That's a beautiful new program, to Shenandoah up in the Winchester and Leesburg areas, Lynchburg, and in Richmond, Virginia Commonwealth, which is one of the most well-established programs in the country, not only the state. So those are 9 programs that you could go to, and depending on where you live, you can apply to multiple programs, of course. There are 11 CAPTE accredited PTA programs or physical therapist assistant programs in the Commonwealth of Virginia, again, as of this year. So I put Germanna first, but that's really because it's alphabetical. So there's a program at Germanna. There are actually 2. There's what we call an expansion program through Laurel Ridge Community College that was up until, or it may still be, they're just changing the name to Laurel Ridge. It used to be Lord Fairfax Community College, if you've heard of that. So we have a program where our students actually take their lectures together on Zoom. So the group at Laurel Ridge is sitting in a room on a Zoom screen, taking their lectures along with the Locust Grove Germanna students. Actually, they're all Germanna students. Some of them are just sitting at Laurel Ridge, and then they have their labs separately. Northern Virginia Community College has probably the oldest PTA program in the state. Tidewater is also a very well-established program, and Patrick and Henry Community College is the 4th VCCS school, Virginia Community College school, that offers a PTA program. On the other side, you'll see some of those private colleges that I talked about. ECPI University has 2 programs, one in Newport News and one in Richmond. Radford University in Roanoke, and Radford is a 4-year college, but they have a PTA program. And there's Riverside College of Health Careers in Newport News. And then South University also has 2 programs, one in Richmond and one in Tidewater. So that's just the lay of the land, and you can find all this out. If you ever want to go back and say, where were those schools again? You can go to the CAPTE, CAPTE. Their website is actually capteonline.org. I'll put that in the chat. And you can find a listing. You can go on, it has a map, and you just hit Virginia and it'll show you a listing of all the Virginia schools. By one tab is PT and one tab is PTA. You always want to look that the program is accredited or has what's called candidacy. A new program that has candidacy is very, very likely to then get their initial accreditation. They make it very difficult to get candidacy. I know because I've been through it. That's the hard part. 99% of them then move forward and get initial accreditation. So it's not much of a risk to go to a school that has what's called candidacy for a program. When you're a candidate program, you can accept students and they grant you accreditation when that first cohort graduates. But if you see that accreditation has been withdrawn, is the word they use, that's not a good bet for you, because you need to graduate from an accredited program. Any questions about that? So we talked a little bit about the PT tech or aide position. So support jobs in the field. Those are unlicensed, as I said. So you can walk into any PT clinic and say, do you have any jobs available for a tech or an aide? Either word would work. And that's a great way to get your feet wet and think about going into the field. So, and then I mentioned that you might have an office manager who's handling all those technical kinds of things that are not patient interaction based. An aide or a tech will interact with the client or the patient, and they may help them by handing them the equipment they need to do an exercise. But they do not perform activities that require the ability to assess or decide what's best for the patient. So they can't decide to increase the weight that someone's exercising with, but they can hand them that same weight that they used last time. So they do interact with the patient, and it varies, quite honestly, clinic to clinic as far as where that clinic feels the line is for a tech to interact with the patient. And it's an excellent preparation step for PTA or even PT school. I highly recommend it. There are no requirements to becoming an aide, Vishanti. There are some programs out there that are more like 1 semester kind of certificate programs, even through some of the VCCS schools. But most people, I would say, become techs or aides without that. But certainly having that credential you could walk in and certainly have a leg up in getting a job in one of those clinics. Good question. So let me make sure I didn't skip a, I did. What happened? I must have been. Oh, no. What happened? Hang on. I'm going to stop sharing for a sec. Talk amongst yourselves. All right. Let's do this again. Sorry about that. All right. So one of the biggest questions is, I am sure that in some of these sessions you have learned about the associate's level nursing degree and how you can take that straight to a bachelor's of nursing. It's a little different with the physical therapist assistant to a PT. Oh, I love those dogs. From the PTA to the PT degree. Because a PTA is an undergraduate associate's degree, the courses that you take in a PTA program, even though they are going to be almost the same as the same kind of course in the DPT program, are not transferable. And they're not transferable because faculty requirements are different in the associate's degree field. And so they're not considered equivalent. You can transfer them toward the completion of your bachelor's degree, though, as electives and that sort of thing. So there are programs such as a bachelor's in health, trying to think the name. It's escaping me at the minute, but a bachelor's degree in other health related fields like health technology or health administration is what I was trying to think of. So those credits can be transferred as part of that bachelor's degree. There are a couple of bridge programs that take a student who has a bachelor's degree, and you could have a bachelor's degree in photography, it doesn't really matter. Anyone who has a bachelor's degree and is a licensed PTA can attend one of these two, what we call PTA to DPT bridge programs. One is actually very close to where I am going to be teaching in Findlay, Ohio. In fact, the person whose place I took got a job there in that bridge program. And then the other one is in Texas at the University of Texas Medical Branch. Those programs do a lot of online coursework because, as I said, PTA, we know that PTA students and graduates know all this stuff they may need to review. So a lot of it's online, and then they have some selected weekends on campus. So that's something that you could do down the road, even working as a PTA. In fact, we have a graduate who is doing the University of Findlay program right now. She already had a bachelor's degree that really wasn't related. It doesn't matter, but she was a licensed PTA after having graduated from Germanna, and she is now earning her DPT degree in a 3-year hybrid program. So that's another option for stepping that up. If your ultimate goal is to be a PT. Okay, so what do they have in common? They're both hard, I'll tell you that. They both have selective admissions, and you have to go to each college and find out what their admissions policies are. We give extra points for cute dogs. No, we don't really. I'd like to. But you have to go to whatever college website you're applying to and read it really carefully. And if you don't understand it, make sure you go to a counselor and have them explain it to you. They can be very complicated, and unfortunately, they're not the same. Even in the VCCS schools, requirements are different from one to another. They're not terribly different. The coursework is going to mostly be the same, your prerequisite coursework. So you really have to do your homework going in. For some programs, you have to do some clinical observation hours, which means calling up a clinic and saying, I need to do this. The clinics all know we've been doing it for years and years in this field. Calling up the clinic and saying, I need to do some observation hours. Are you accepting the students for that? And every school will have its own form that you have to get filled out either and get signed by the person, the PT or PTA that you were observing. Okay, you don't have to do anything, you don't have to know anything, just have to show up and be engaged and interested and learn from it. There are, as in all health careers, there are a lot of lab hours, a lot of hours in the lab, learning hands-on skills, learning the equipment we use, that sort of thing. There are classroom lectures. Some of it's online in some places. Most of it's in person though, when we can. And then another big piece is the clinical education. We do that a little differently in PT than in nursing. So what we do is clinicians who are working out in the field volunteer basically to be a clinical instructor. So they are not paid faculty, they are working clinicians. And we pair up a student with a CI, or sometimes two students with one CI, clinical instructor out in the field. And every college is a little bit different about this. For Germanna, you have to have a certain number of hours, but they can be broken up in lots of different ways. Germanna does 1 4-week and 2 6-week full-time clinicals. So when you're in those clinicals, your hours are whatever your clinical instructor works. So it might be 8 to 4, it might be 8 to 6, 4 days a week. It could be anything. So your schedule has to be able to accommodate that. As I said, they're hard, they're rigorous, they're demanding, but everything worthwhile requires a little bit of extra effort. We do demand really professional behavior. So we're training you not just to know skills, but to have a certain behavior in the clinic. So there are expectations for that. They both require immunizations, background checks, drug screens. Okay. We do background checks and drug screens because our clinics that we send you to require it. All right. So every year there's a background check and a drug screen. And then there is financial aid available for both, as we sort of talked about before. I'm going to open that. Okay. So that's sort of a little bit about what it looks like. There are detailed manuals in all the programs of what the expectations are. All right, so let's say you're interested. What's your next step? Your next step is to go to the website for the program you're interested in. Okay, so we can make that list available to you. I'm sure Ms. Wind would help us do that maybe if you're sending out information from the CAPTI of the programs in Virginia, or you can go to that website that I put in the chat, captionline.org, to look for the programs that are available in your particular area.
I also shared with them the Healthcare Careers Manual that the Virginia Health Workforce Development Authority just released in partnership with AHEC. So it's as current as it was published. So obviously it's just been published, so it is accurate currently.
Okay.
But as the years pass, it could be that that website is more accurate than our
Well,
book.
right.
So both resources are great. So I'll be sure to share both.
Great. Great. Yeah, it's always good because accreditation can be pulled at any time. You know, sometimes it's the school has asked for it to be withdrawn because they are phasing it out or whatever. So that's very important. So make sure you go to that website, and usually you can go in the search bar and just put PT or PTA, whichever you're interested in, and it'll pull up that page. Look for information sessions. Okay, that's a big thing that we do. Germanna, we have one every month. It's actually required for an applicant to sit through one because we want to make sure that every student gets the same information, so there's a level playing field when you apply. All right, sometimes they're pre-recorded, sometimes they are on Zoom, sometimes they may be in person. There are some entrance exams that different programs need. If you were to apply to a DPT program, you're going to need the GRE exam for most of those. PTA programs often require the TEAS exam or some other academic readiness exam. Prepare for those. They're designed, and I assume most of my audience here is in the high school graduating or recently graduated from high school. If that's the case and you did well in high school, those things are still pretty fresh for you. If you graduated a while ago, you want to do a review for a test like the TEAS. And they do have review materials on their website that, yes, cost something, but they cost less than trying to take it again. And I will tell you that taking it again doesn't usually result in a better score, but preparing does. Again, read those websites carefully. If you have to talk to somebody and ask questions, you will get a better result if you go through the regular advising route and then save specific questions that they can't answer for somebody like the program director. So you're going to see on the website, we have to publish who is in charge of the program. We have very small faculty especially for PTA programs, and answering initial basic questions about like, what course do I need to take? Those can be answered by a counselor. And that's where we're going to send you anyway. We sort of reserve our kind of precious time for questions that are, well, I have this, do you think that would count? Those kind of more advanced questions, if you will. So don't try not to just decide that your first step is to contact the program director and say, hey, I'm interested in the PTA program, because we kind of go, I don't have time, I don't know what your question is. So you make a better first impression if you have a specific question. And make sure you've researched the program beforehand and you've identified your specific question before you do that. So that's the end of the slides I prepared.
Thank you.
What questions do you have after hearing all that?
All right, everybody's still silent. It's a silent day, Laurie. You've provided such detailed information, and so that's really awesome on where to check. So, definitely thank you for that. It is much appreciated.
Absolutely, absolutely. And I will say, if you're interested in Germanna, okay, we do have a question. I'll get to that in a sec. Tracy Williams, who has been with the program since its inception at Germanna, is now the program director. And so we're she's just ready to keep that rolling.
Good.
So Vishanti, in high school, is there any volunteering you can do? Absolutely. So you could certainly go to a clinic, any clinic, call them up and say, hey, I'm a high school student. I'm interested in possibly in physical therapy. They will welcome volunteers. You know, you can help them fold laundry and that kind of thing. You won't do actual patient care, but you will learn an awful lot. And if you're interested, clinicians are real quick to say, hey, you want to see me do this? We don't do this in the clinic very often. Come on over and I'll show you this technique. So yes, you can absolutely do that. And for most programs, if you do that, those can be your observation hours. So you don't have to like volunteer while you're in high school and then go out and do separate observation hours. As long as they're within, for Germanna, it's 3 years. It's good enough for us. Yes, volunteering's great. You're so welcome.
Okay, good.
And I see Kara Ballard in this group. Hi, Kara.
So it's nice when we see people we recognize, and it is nice to see the participants from yesterday here today as well. So we like that.
Hi, Laurie. Great presentation. I can never learn it. I feel like I walk away with something new every time.
Good to see your picture anyway.
Yeah, well, you won't see me live because I'm at the beach, and it would not be fair if you guys
lucky you. Lucky
with the ocean
you.
in the background.
All right, everybody. It's been a pleasure to talk to you. And
all right. Thank you, Laurie. And so I'll go ahead and close this out. Laurie, again, thank you for your time. Absolutely. And for all my participants, I want to make sure that you are in the running for those gift cards and those prizes that we have going on. So we don't want to miss that. And one way you can do that is by making sure you fill out the evaluation at the end of the day. So let me drop that in the chat for you here. Okay, you see that now. And we are going to take a 15-minute break. We will return at 3 o'clock for our next presentation, which is on radiation oncology. So we have got some great topics going on today, great information that's being given out here, like Laurie's information. I'm just so thankful to have these community members to share that knowledge with us. And, you know, if we don't learn it anywhere else, and we're learning it here, and this is great, and it's a free resource. So everybody, we're going to see you at 3. Laurie, thank you again for being
thank you all for having this.
All right,
wonderful.
Have a great day. See you at 3, everyone.
Bye, everybody.
Stay in touch.